Lower limb amputations. EXS 486 by Chyce Davis. I apologize in advance if I pronounce any of the words wrong throughout my video. What is an amputation? An amputation is when there is a surgical removal of a part or all parts of a limb or extremity, such as the leg, foot, arm, toe, hand, or finger. History of amputations. 1.8 million Americans are living with amputations. The most common amputations are the lower limb, right above and below the knee. Amputation started in the 1500s when a French military surgeon, Ambroise Paré, rediscovered the use of ligatures, a thread or string for tying the blood vessels/arteries to prevent bleeding. The tourniquet, which is an apparatus designed for the compression of the vessels for the limb, in 1674 further advanced the practice of amputation. History continued. Prosthetics, an artificial body part, came about in around 1858. A lot of Americans today use prosthetics when they have a limb amputated. Causes for amputations. Peripheral artery disease. Poor blood circulation because of damage or narrowing of the arteries. Severe injury, like a vehicle accident. Cancerous tumor. Serious infection that does not get better with antibiotics. Neuroma, thickening of nerve tissue, and also frostbite. Types of lower limb amputations. There are 5. Foot amputations, below the knee transtibial, knee disarticulation, above the knee transfemoral, and hip disarticulation. Foot amputation. Maybe the toes or any part of the foot. Toe amputations are mid-tarsal, Lisfranc, Boyd's, and Simmons. Physicians and therapists will help with healing and build your strength back. They will also help you to get around and learn how to care for your foot and prosthetic. Below the knee, transtibial. From the knee to the ankle. Reasons range from ulcers, foot ulcers due to diabetes, to reduced blood flow caused by peripheral vascular disease, severe infections, etc. Knee disarticulation. Amputation occurs at the knee joint, leaves femur and patella untouched and does not cut through the muscle or bone. This is done when surgeons can't perform an amputation below the knee. Above the knee, transfemoral. From the hip to the thigh to the knee joint. Removes the leg above the knee joint when it has been severely damaged or diseased. Mid-thigh amputation is chosen when the lower leg and knee cannot be saved. Common causes are diabetes, trauma, cancer, etc. Hip disarticulation. At the hip joint with the entire thigh being removed. Lower limb is removed through the hip joint. Medication that increases the risk of amputation. Sodium glucose cotransporter 2, SGLT2 inhibitor, which is a diabetes medication, is usually for type 2 diabetes. It reduces the blood glucose by blocking the activity of a protein in the kidney. It includes dapagliflozin, used to improve glycemia control, canagliflozin, reduces blood glucose, and empagliflozin, improves glycemia. Medications that help relieve pain from amputations. Non-steroidal anti-inflammatory drugs like ibuprofen, antidepressants, amitriptyline, ugh, nortriptyline. They work directly on leg nerves. Corticosteroid stops the nerves from sending signals to your brain so that you won't be able to feel pain. Lower limb amputations affect exercise. There are many ways that lower limb amputations affect exercise. 1. Psychological impact. You have to cope with the loss of sensation and function from amputated leg. Sense of body image and other people's perception of your body image is now changed. You feel anxiety, depression. You could be in denial, refusing to accept that you need to make changes, post-traumatic stress disorder, and also feeling suicidal. Complications of a limb amputation are heart complications, which is a heart attack, deep vein thrombosis, DVT, which is a blood clot that develops within the vein, deep vein in the body, usually in the leg, wound infection, pneumonia, and stump/phantom limb pain. Continued. Recovering. Painkillers, which is not so good because you can get addicted to them. Physiotherapists will teach you exercises to help prevent blood clots and improve blood supply while recovering in the hospital. Use a compression garment to help with the swelling and shape the stump. Also, it takes a while to fully recover after lower limb amputations. Lower limb amputation on exercise continued again. It makes it harder to do exercises. Most exercises now are going to be unilateral. Body is working harder to regain strength and function without the extra base of support. Experience a lot of soreness, especially if your hips aren't aligned anymore. Many amputees decide not to exercise often because of physical and social barriers, especially when going to a fitness center. Fitness centers might not have the equipment for people with amputations, or their employees might not have the right training to work with amputees. It's also stressful and can be discouraging because some people with leg amputations don't know where to fit in when it comes to physical activities and daily living. They have less nerves in the leg to send signals to the brain and how to function, and you also feel quite tired quickly because the body and heart are working harder and faster. How exercise affects lower limb amputations. Rehab exercises after lower limb amputations help to improve range of motion and strengthens the whole body to support the new change. Also, exercise helps to reduce pain levels and hypersensitivity. You don't want to become completely immobile because it can cause your muscles and joints to become tight and hard to move when you're ready or when you want to. That's why you should always be as active as you can be. Pharmaceutical indications and how they affect exercise. Antidepressants can cause drowsiness, dry mouth, excessive sweating, and fatigue. Corticosteroids could cause weight gain, bone loss, blood sugar changes, and swelling of the airways. And sodium glucose cotransporter, increased risk of bone fractures, hypotension, and amputation. Case study. Nina is a 64-year-old social worker. She was in a bad car accident and injured her leg terribly a year ago. In that time, she learned that she had type 2 diabetes and had to get her leg amputated. Other than that, she is healthy and wants to improve her strength with her amputated leg. Her total cholesterol is 190 mg/dl, LDL is 120 mg/dl, HDL is 40 mg/dl, triglycerides is 150 mg/dl, blood pressure is 124/80 mmHg, and her resting heart rate is 65 beats per minute. What exercise test would you Question 1. What exercise test would you choose for Nina and why? Question 2. Develop an appropriate exercise prescription based on Nina's information above. And question 3. What are exercises that Nina should focus on mainly to improve her strength with an amputated leg? Question 1 answer. I would use an echo stress test and/or a cardiopulmonary exercise test, CPET. An echo stress test because it helps determine her risk of developing cardio artery disease, and cardiopulmonary exercise test to determine how her cardiopulmonary system supports her energy demands on the contracting muscles. Exercise prescription for question number 2. Aerobic, F, 4 to 7 days per week. I, light, 27.3 to 36.4% heart rate reserved, to moderate, 45.5 to 54.6% heart rate reserve. T, start with 10 to 20 minutes daily until you can get to 30 to 60 minutes daily. T, walking, swimming, cycling, etc. Resistance, F, 2 to 3 non-consecutive days per week. I, 1 RM. T, 8 reps per exercise comfortably. T, 2 upper body, 1 core, 2 lower body exercises per session. Flexibility, F, always after exercise. I, stretch until slight discomfort. T, slight T, 30-second holds each stretch. T, static, dynamic, and PNF stretching. Balance, 2 to 3 days per week. I, progression. Example, standing holding a chair to standing holding a chair with eyes closed. T, about 10 to 30 minutes. And T, reaching, twisting, standing, etc. Question number 3 answer. Strength, seated push-ups, partial squats and pelvic tilts. Endurance, stationary bike, treadmill. Balance, even weight bearing, all fours, hip lift, and uneven surfaces, etc. Agility, braiding, circles, and ball tosses. Conclusion: you should always make sure you stay on top of your health. Also practice safe driving at all times. If you have an amputation, don't get discouraged because you will find a way to get through it and be a stronger person in the end. Along with your exercise prescription, you should always make sure you talk about how you're feeling with your doctors and your support systems because it's healthier for you to express how you're feeling with your new changes. References.